Добрый вечер. Это программа «Перша, студия» на ЮА Перши. И вести ее буду я, Катерина Булавинова, медицинский эксперт детского фонда ООН ЮНИСЕФ в Украине. Hello, David.
Katya.
It's very nice that you agreed to come again to this program because you were here quite recently. And my first question is about the global health security, because this is the new kind of sentence which is now everywhere. And for people, it sounds like something about bioterrorism or something, but then when you speak to the experts, it's as well about antibiotics, vaccines. So what is this, and what is your role in this?
I think that there has been an appreciation recently that issues in health don't just affect health and don't just affect individual countries. So if you think back to the circumstance of Ebola as an example, Ebola didn't just affect the health of people in those three countries that were so severely affected. It had a huge impact way outside of health. Of course people were ill, of course people died, but there was a huge impact on the economies of those countries. And the impact spreads beyond individual countries. And so we have to think about health in a much broader context of not just the health system, but the whole country, and also internationally of the relationships between individual countries and the health consequences that one country can have on another. And that's how we come to think about global health security and its relationship with, for example, infectious disease. And we all have a responsibility towards each other in our ability to prevent infectious disease so that we use our vaccines effectively, so we prevent infection, so we save our own economies, we save transmitting infection to other countries, and we help their economies.
So is this global health security more about prevention, or it's more about response in some unexpected horrible situation?
I think it's both of those. Clearly the best thing that we can do is to prevent these really terrible circumstances happening, and Ebola is a good example. But equally, we must also act rapidly and comprehensively and harmoniously when these things happen. So we have both to prevent and we have to intervene, and that's where you mentioned antibiotics, and that's where we need to think very carefully about the consequences of the misuse of antibiotics in the present and future as resistance increases and the number of antibiotics we have available to us for ill and very ill people become fewer and fewer.
And where is the role of the government in all of that? Because yes, experts sit in Chatham House in London, and it's very stylish and nice, and sound very nice, Royal University. But how does it come to the governmental decisions?
Well, I think one has to take this back to an individual country and an understanding that health affects society, affects the government, affects the country, and we can't just depend on health ministries being the solution to all of the problem. The problem is across government, and we have to have coalition through government to deal with health issues. And that's where health security has a national and international relevance. So we must be aware that you can't just expect the Ministry of Health to have the resources, to have the capacity for something that can be cross-government. We need the Ministry of Finance, the Treasury, to appreciate the importance of health. Education must play a part because we need educated young people who are going to turn into educated adults. We have to have many government institutions all playing their part. So it's a cross-government phenomenon, not just one for health.
Is it the cross-government phenomenon in UK, and how you came to this? How you forced other ministries to participate in the Ministry of Health agenda?
I think one of the best examples from my experience was when we were facing the threat of an influenza pandemic. And when we were accelerating all of our preparedness, it became very clear that this was not just health. This had to be preparation across government. We had to have the Ministry for Industry, we had to have the Ministry of Education, we had to have Treasury, we had to have all of the government departments working in collaboration, because of the consequences of a pandemic would affect the provision of everything from money inside the banking machines through to the preparedness to keep essential services going. If you were going to have a significant proportion of your workforce ill, who was going to maintain electricity supply? Who would maintain food supply? Who would maintain money supply? And when you start to think like this, you realize that health threats are not just for health, they cross government and they cross the community. And that's why we talk about health security rather than isolated health problems.
And how does the Chatham House bring its thoughts, its expert opinions to the governments? For example, how government of Ukraine will know what is on the agenda?
Well, Chatham House is a think tank which is independent of government, but it does work, for example, with many governments, not just UK government, in bringing people together to have independent opinions that they can share. But Ukraine is not an island that is insulated from world affairs, and I am sure certain that the government of Ukraine is very aware of many of these discussions about global health and security. So the opportunities are certainly there. And I think that we today have experienced an example of an awareness within the government of Ukraine that communicable disease is not just something for health. We heard today about the awareness from other ministries of the importance of prevention of infectious disease through vaccines.
So you came to participate in the round table, which basically occurred today and which was on the fact that Ukraine has the lowest coverage of vaccines in the world. What you think is your advice to the government for the moment with this situation? And when we were coming here, you said that when you were head of the program in UK, for the communication only, you had the budget of what, 1 million, 2 million pounds? So is the key funds for communication or something else, or political will? What is the key?
Well, both of those are critically important. When I was preparing to come here, I looked at the elements that I believe are essential for an effective immunization program. And they include surveillance of disease, surveillance of coverage, supplies of vaccine, surveillance of adverse events, communication, training. And as I looked at this list, I thought to myself, but Ukraine does all of these. It has the capacity for these, but they don't work as well as they should work. And then I looked at my list again and I thought, well, what is it that makes this spider's web function effectively? And it functions if there is leadership, if there is accountability, and if there is communication, and if there is management. And it was, to me, gratifying to hear that the Ministry of Health is talking positively about leadership, about resources. And so my hope is that in the future, we will see these elements that existed in Ukraine, but were not necessarily functioning effectively, being brought into a much more functional framework. You asked about communication. My experience is that it is an essential part of a successful immunization program. You need to be able to communicate clearly, authoritatively, to both parents and the public on a wider basis, because there's not just parents involved in decisions. There's grandparents, there's many other influencers within families of decisions. So you need to be able to communicate widely to the public, and you must be able to communicate effectively and convincingly to health professionals, because health professionals are the trusted intermediary to the public.
So you have a budget line to communicate to public and the budget line to communicate to the health professionals, because communication is money. So
Yes.
how do you resolve it in the UK?
There was a budget for communication for immunization, and within that budget, money would be spent on public communication, but also on communication for health professionals, particularly training. And so whenever a new vaccine program was being introduced, a training program would be prepared in advance so that the same material would be disseminated throughout all of the country, so that everybody was trained with the same material. So there was no opportunity for people who've got different views to be influencing the health professionals, for example, about a new vaccine. Everybody was trained with the same material. So I didn't distinguish between a program of training or a program of communication for the public and a program of communication for health professionals. They are very much the same materials. It's very important that the public believe that they have access to the same material that the health professionals are having. Because if they believe that the health professionals are receiving something different, then that's the beginning of suspicion and the beginning of loss of trust. So the material that is used for health professionals must also be available to the public, and vice versa.
And what are the keys to the successful outbreak response? Because everybody is afraid of different outbreaks, and there are movies about big outbreaks,
Yes.
pandemics, epidemics, and everything. And we had an example of Ebola, example of pandemic influenza. So what do you think is the key, what the government should think about to become successful in response?
There's no single word, but it's prepare, practice, response that is rapid, that is effective, and that is resourced. And if you can fulfill those, the framework is the same for probably any outbreak. You must prepare, you must practice.
What do you mean by practice when you say practice?
Have
Pretend
an
that there is-
exercise, a tabletop exercise, a dummy run, so that you bring a group of professionals together and you run a scenario. They don't know whether it's true or false. And you run a scenario that there has been an outbreak of polio in a particular part of Ukraine, and you interview them as if they were on television. And they find that quite difficult if you ask them tough questions. And you prepare, you practice, you must be able to respond rapidly, you must have resources available for that response. And if you do all of those effectively, those will be common skills that can be applied across different outbreak potentials.
How high is it now internationally on the agenda? Do people practice a lot? Do people train themselves a lot in this outbreak agenda?
I think that currently, if we take polio as the example, from Europe, there has been a really effective training package of tabletop exercises that were pioneered by WHO for the European region and are now being taken on by other regions. And they started with groups of countries that were neighbors, for example, working together. Some countries have done these exercises on their own. And then there have also been exercises between countries in the European region and neighboring countries in neighboring regions.
And are countries now more into being open with each other, or more into hiding it from each other in case something happens, any outbreak or anything like that?
I think there is increasing openness. I would sincerely hope that there is increasing openness. Nothing is gained by hiding outbreaks, because if you hide an outbreak and you fail to deal with it, it will only be a worse outbreak.
Okay. There is a delicate discussion going on now in Ukraine about the fact that lots of people from medical community and especially from academia are using non-evidence-based medicine and are talking in public about non-evidence-based approaches. Like, for example, doing tons of analysis before immunization, which is not recommended. But it's not only around immunization, it's about obstetrics, about pediatrics, about lots of other things. So what to do, managerially speaking? Should it be just forbidden, or, I mean, what to do with this? Because this is very delicate. All these people are quite senior, not only in the age, because not necessarily, but quite senior in their position. So what to do about it?
I think you pose a difficult question. The first is that the information that we, and I say we as those responsible for immunization programs, the information that we provide must be credible, accessible, competent, backed up by science, and the evidence available so that parents, for instance, can see the evidence. If we make claims about the safety of vaccines, we should be able to show the evidence on which we justify those claims. So we must be fully armored against the challenge. I don't believe we can ban people from having a voice. I come from I believe, a society that permits people to have opinions. But I think when those opinions are frankly dangerous, we should challenge them. And if somebody has an opinion that children should not be vaccinated against measles, or an opinion that children should not be vaccinated against whooping cough, I believe you might want to take those people and show them just how ill a child can be with measles. Show them how ill a child can be with whooping cough. And even parents could see films of how horrible whooping cough can be, so that they appreciate that there are consequences from some of the recommendations that they make, some of our medical colleagues, and show parents that there are consequences from some of the choices that they make for their children.
But don't you think that the debate between different medical professors in front of public cause even more kind of mass into the whole thing, cause even more confusion?
Yes, it can. And what it does is give credibility to heterodox opinion. And I think it is the same question that arises about how you deal with individuals or organizations with anti-vaccine views. And I do believe that the more you give them oxygen, the more you give them credibility. And the more you engage in public debate, television debate, the more difficult it is to say to somebody in front of a camera, what you are saying is a lie. What you are saying is untrue. What you're saying about a vaccine causing a particular adverse event is wrong. It's very hard to do that. And sometimes it's better not to engage in the debate, because each time you engage in the debate, you give some credibility to the alternate view. So I'm a skeptic about the value of engaging in debate, particularly when the probability that you will change the view of the person with whom you are debating is very, very small. We are not talking to people who accept the scientific evidence that we take as sufficient. We're talking to people who have belief that is not evidence-based, and changing belief systems is very tough.
Why antibiotics are so much on the agenda of the health security?
Why are antibiotics?
Mm-hmm.
Well, I think that the reason is that we are increasingly aware that we are running out of antibiotics because the organisms that we wish to treat are increasingly becoming resistant to the antibiotics that we have available. And over the last 20 years, despite huge investment, it has been very difficult to come up with new antibiotics at reasonable prices that do not have resistance. So unless we become better custodians of our antibiotics, the risk is if we do not become better custodians of our antibiotics, the risk is that in the future we will not have antibiotics. And that will take us back to an era of 100 years ago when infection was such a serious threat. I am a firm believer that one of the best justifications for the use of our existing vaccines and our future vaccines is that they prevent infections in the first place. And if you prevent infection, you don't run the risk of antibiotic resistance.
And what is UK doing for the antibiotic resistance now?
Well, there is a lot of work both within the UK and in the international community to work on a number of different initiatives. The first is to try to become good custodians of the existing antibiotics, so that we should not give antibiotics when we believe somebody has a viral infection.
Very popular approach in Ukraine, by the way, and parents themselves want to get antibiotics.
The public demand an antibiotic, and the doctor knows that this is most unlikely to be a bacterial infection, but gives in to pressure. In some countries, you can buy antibiotics over the counter without a prescription.
Like in Ukraine.
And that is exactly the system that we believe is favoring the antimicrobial resistance. So one of the pillars of the strategy is stewardship of antibiotics. So only using them when there is clearly an indication. The second is to work with the pharmaceutical industry to encourage the development of new antibiotics, although that could take a very long time, be very expensive, and not necessarily transform our problem. And the third strategy is the one that I have mentioned, and that is to use vaccines to prevent infection and to invest in future vaccines, again, to prevent infection.
All of this, like vaccines, antibiotics, outbreak response, it's all about behavior of people. First of all, behavior of healthcare providers, and about the change of this behavior. So what do you think are the three key things which can allow the changes of the behavior of the healthcare providers, in your experience? I
think changing behavior is very difficult. I think we speak with facility about how we wish to change behavior. But we are human beings, and we're not necessarily even very good at changing our own behavior. If we think about the things that we do every day in our lives that are not necessarily healthy, we clearly are not very responsive to messages about behaviors. So I think that it's easy to say, it's much harder to do. We need to be able to provide health professionals with the evidence on which they should change their behaviors. And we need to communicate, I think, to them their responsibilities in changing their own behaviors and changing the behaviors of their clients, their patients, their contacts. For example, in the UK, we are able to persuade people of 65 years and over to have their seasonal influenza vaccine. And we reach close to 75% uptake of those people every year.
I am not asking how old are you, but are you vaccinated against influenza this year?
And the answer is yes.
Good. And this
it is much harder to persuade the health professionals
to give it, right?
To receive it for themselves.
The same in Ukraine.
Whilst they will give advice to their patients about the benefit of being vaccinated, they don't take their own advice. So this is where we need to be more effective at changing behavior, but I make no mistake in thinking it's easy.
Thank you very much for coming to this program again, and I hope to see you again next year in Ukraine in this program. Это была программа «Первая студия», ЮА «Перший». Ее вела я, Екатерина Булавинова, медицинский эксперт детского фонда ООН ЮНИСЕФ в Украине.